Cardle and Woolley on Talk 1370.
We're joined now by Congressman Pete Sessions, who is just out of a meeting in Washington. Congressman Sessions, let me just start by asking you about this thing going on with this ship, this oil tanker at Venezuela. Have you been briefed on that? Has Congress been briefed on that? Do we know anything now that we didn't know earlier this morning?
No, I don't. But let me tell you what, this administration is moving in a direction that I so much am proud of and support. You see, just like the Russians who are using their oil to gain the revenue to fight against Ukraine, so is this drug cartel Venezuela issue. They also gain money from this vast resource that they have. So I'll be honest with you, these things are talked about by people who actually want to see a victory by the United States in this area, and I could not be happier. But you don't really probably come and tell everybody. And
yes.
The problem is once you tell necessarily 10 of somebody, you got to include both sides. And so it's easier to ask for forgiveness than permission, probably. So it's given them an opportunity to make sure that they have their ducks in a row to where they can answer questions. But, Jim, I'll be very honest with you. This is similar to the circumstance that we have with the drug boats.
Mm-hmm.
Now that the cat's out of the bag, it is up to the Intelligence Committee, in this case the Armed Services Committee, to have their briefings now that the initial boarding has been done, and our people who cover the State Department to make sure that they understand how all this works, and that would be committee work. And then if they've got a problem with it, state it now, not a year from now, when they bring up, about these shooting at the fast boats. We need to make sure that the administration has a full, complete, documented, understood policy, and then it creates a better circumstance for us to continue this activity. Otherwise, it becomes controversial. So I'm so proud of the Trump administration.
Congressman Sessions, I'm thrilled, and thank you for those comments, because I think most of Americans are feeling the same way. I want to get to the health care effort. You've been involved in health savings accounts for a long time. That's now at the forefront. You're going to be voting next week. But first, you've also been involved for a long time on the war on drugs, the quote-unquote war on drugs. What is it? You rub elbows with these monkeys on the Democrat side of the aisle up there on a daily basis. What is it about them that they cannot understand that Americans don't want drugs? We are sick and tired of being sick and tired. Our I give a damn meter is absolutely broken, but yet they're continuing to stand up for the criminals in this type of debate.
Well, in fact, they do, Mr. Cardle, and they do because they simply oppose Republicans. They don't want to find any really bipartisan activity. As you know, this takes place in the form and way of not just immigration, because the drug cartels got their marketing organizations in the United States, courtesy of us.
Yep.
And they are forming this ring of addiction now. Instead of just Austin, Texas, and Dallas, Texas, it is in Waco. It is in Abilene. It is in Tyler. It is in all across the United States. Their marketing organization, and then their product, of course, is marijuana, THC as an addictive product, but also to cocaine. But then they went to fentanyl, and that was the Chinese trying to up the ability of people to keep being addicted. and they killed what would be the equivalent of 2 brigades worth of Americans.
Yes.
Because they have made it to where these young people did not then get to age where they would join the military. Anyway, it's just a dismal view of the world. Now, I don't always subscribe it on a Republican and Democrat basis, but what I will say is the health care issue that you speak of, no question it is. They are hung up on the Affordable Care Act. And, Jim, you've heard me for years,
yes,
going back to President Obama. I spent 7 years as a member of Congress on the Affordable Care Act.
Yep.
And during that period of time, my insurance, not only the cost rose dramatically, but I found myself from the very first year through the year 7, I did not ever use anything but my deductible, which meant that I paid $20,000. I paid $28,000 15 years ago for my insurance, but I only used my $8,000 deductible. I never used my account. And what Republicans are trying to do is to allow, at least in the Senate, Bill Cassidy, and I don't know that it's going to pass with 60 votes because Democrats don't want it to,
yep,
is that we would allow people who are in the Affordable Care Act to use this as an HSA, meaning that they could save the money, put it into account, and then graduate out of Obamacare over a short period of time. But what is absent is the thing that I do support, and that is for instead of just worrying about the 13 to 20 million Americans on the Affordable Care Act, let's worry about the 120 million Americans that don't have employer-provided health care, and they should get the same subsidy or deduction that everybody else gets, including members of Congress, that get to buy their health care on a pre-tax basis.
Well, Chuck Schumer has called the Republican plan over in the Senate phony and said the bill is dead on arrival. They're looking for a 3-year extension of the Obamacare subsidies. This will be the last question, because we're running out of time here, Congressman, but isn't that the same thing, what the Democrats want, pretty much the same thing as just writing a big check to the insurance companies?
Well, it could be, but it's denied. The way I look at it, Lynn, and you're correct, it is a big check because people don't use their insurance, they use their deductible. It's really denying Americans a chance to have effective, affordable health care, and it's this one thing that our colleagues over there need to tell them. You only go to a provider that you pay that ends up getting paid half of what they would be reimbursed by on employer-provided health care. And so they want to have them continue in what might be less than marginal circumstances of health care available to them. And I think that wins. That rings true if our Republican senators chose to speak with clarity.
Well, we will watch this health care thing very carefully. I think you would agree with me when I say that it will have an effect on the midterms coming up because those subsidies are about to expire. I think the Republicans have a good bill over in the Senate, or at least it's certainly a big improvement over Obamacare. Congressman, it's always a pleasure to speak with you, and we will talk to you again in a couple of weeks.
Cardle and Woolley, weekday mornings, 7 to 10 a.m. on Chalk 1370.